hit restart broadcast. I think that should work.
Okay, and then it says end broadcast early.
Yep, so I think you are live now, Sean, so I'm just going to let you be.
Okay, thank you very much. Hello. I hope everyone could hear me.
Apologies for the
technical issue there with the I wasn't actually live and presenting and giving the first presentation. So I do apologize for the slight delay. So to the conference, to What Works Global Summit 2022. I hope you've all enjoyed the conference so far and listening to some of the talks. Just a number of speakers who weren't able to attend today. So what we're going to do is run through the first three speakers. I'm going to be presenting first on behalf of Rachel Leonard, who's due to give her talk this morning. I hear from two other speakers about their projects related to improving public safety. As I said, I'm going to present first talk on behalf of Rachel Leonard. This is a systematic review that was a project that was looking at the determinants of COVID-19 health-related behaviours, and particularly looking at the psychosocial determinants. The project was part of quite a big group of international workers, and looking at, and again, it was an interdisciplinary project, and the aim was to look at a series of reviews looking at the individual common protective behaviours against COVID-19 infection and transmission. So mask wearing and the use of physical and social distancing. Other behaviours, and some of which became less important and less relevant during the pandemic. So we looked at things like cleaning of, and we looked at isolation. But what I'm going to do today is focus on one of those behaviours in a review that looked at hand washing. And obviously, the aim of that review was to look at the evidence, examine psychosocial factors that determine uptake and adherence to hand washing behaviour, risk of transmission of COVID in the general public. As you'll see, this was quite a large search that we carried out because we were looking at multiple behaviours. When we ended up screening over 20,000 records, and we had quite a large group of people to help us achieve that and to try and do it quite quickly. So COHeRe part of that, and we had a number of volunteers as well who helped, and that was really to be able to do that, to carry out that task. But you can see in terms of the numbers that we included in this, when we take out the other protective behaviour evidence and we take out studies that were looking at so when I talk about non-malleable, I mean things like and gender. Those factors do determine how people adhere to certain behaviours, but they can't be targeted as part of an intervention. So we ended up with about 65 studies in the review, 20 of which were included in a meta-analysis. Before I talk about the findings that came out of the review, one of the most important aspects was to do with the risk of bias of the evidence. So most studies were cross-sectional. One of the things that we found when assessing the risk of bias in the studies, quite a common factor, was related to the sampling for the studies. So about 30% of the studies didn't have a clear inclusion criteria, and we weren't able to kind of clarify whether the sample
does have implications for
what we can draw, the kind of the strength of the conclusions that we can draw based looking at the overall quality, the effect that had on overall quality. It means that we have about 13-14% of the studies bias. So again, it's something to consider when judging the strength of the recommendations for the study. But in terms of what we did find, and again, these findings are reflected in the and in the narrative synthesis. The behaviours, so the determinants that were most closely related to whether people did or did not behaviours were self-efficacy, so their confidence in carrying out that behaviour, their knowledge of COVID-19, such as how is transmitted and things like that, and social norms also had a bit. So social norms were covering, people's perception, what they were taking part in hand washing. And one of the interesting things we found was that it wasn't people's sense of protecting themselves that mattered. It was their sense around them. So family and friends around them was for why they did take part in hand washing behavior. Interesting finding that came out of the review was that people's views about how COVID was and COVID were linked with how, but their views about their susceptibility to it weren't tied to their behaviors. So again, it kind of motivators for whether to take part in hand washing behaviors were slightly different. And susceptible, which is something that is of interest and we might have expected to have seen before. So in terms of what this means, we found a huge amount of very, very rapidly produced evidence in this area. And it means there is a lot there. But by focusing on the malleable determinants, so the things that can be changed, to use this to inform development of interventions for promoting hand washing just in the context of COVID, but also any future pandemics, and also in terms of general hand washing interventions for reducing risk of other infections. So that's the presentation, but I'd like to draw your attention to just in terms of linking about people's thoughts. Open science framework. And again, we have a and if you search COVID-19 health-related behaviour, you will find the project and all the information related that have been carried out. There's other information there about the kind of expert, the panel that we have set up. Look at disseminating the results and what they mean. And yes, that's everything. Thank you very much for listening. I'd be delighted if anyone had any questions. Any questions? What I'll do is I'll hand over to our next speaker. It's Marchang. I'm going to stop. Sorry, Marchang is going to run through. I'm going to share his screen and talk to you about precarious migrant workers during the COVID-19 pandemic, evidence from Northeast India. So I'll stop sharing, and I'd like to welcome Marchang to the stage.
Can you hear me?
Yes.
I had a question, so should we put it
sure.
for the end? I can ask now.
Yeah, absolutely.
Yeah. Okay. So the review, it seems very interesting. Obviously, I would like to go to the website and see the details. So the review is complete, right? So a very interesting thing is that, I mean, across the news during the COVID-19 pandemic, when there were restrictions being imposed across the world by different country governments, in many development countries there were lots of resistance against the restrictions, especially even about masks and something, saying that it's about individual freedom, right? So I am not able to really understand what was the driving factor behind those kinds of attitude. I mean, of course, claims of individual freedom matter, but what kind of social psychological factors would you say were driving those kinds of resistances? I mean,
So
towards
yeah, in
COVID.
terms of
Yeah.
yeah, and I think we've found different kind of results depending on what the behavior is. So I think hand washing is probably a little less controversial than masks, for example. And we found more evidence for in the review about masks that, for example, was looking at conspiracy beliefs. There wasn't
Mm.
much of that in terms of hand washing. Yeah, and I think that's partly because hand washing is a little less controversial. It's hard, there's less it's less, as you said, about individual freedoms and having to do something which is very different and very obvious, like wearing masks in shops and things like that. So I think the results are slightly different for other behaviors. But I think the driver for hand washing was much more around protection, and I think it's probably a more accepted behavior than some of the others. Yeah, again, we found very different results for mask wearing. We found different results for social distancing. One of the things we've also found is it's very difficult for some of those behaviors. They were defined differently in different studies, so that makes it difficult. And we also found that an awful lot of studies did combined behaviors, so they just looked at all protective behaviors, which means it's very difficult to kind of separate them out. So yeah, I think it's certainly to find different responses depending on what the behavior is as well. Thank you, though. Thanks for the question, Neetu.
Yeah, thank you. That's it.
Okay, so I'm just going to go to Neetu. Sorry, yes.
May I also ask a small question? I mean, for my benefit, maybe. Concerning the hand washing, do you believe or think that the developing countries also are uniformly adopting the hand washing practice like the developed countries in this pandemic crisis?
Yeah,
If you
I mean, I
have
think
any evidence, that would be good.
I would say I could talk about other evidence because we demographic factors, and other people have looked at that, and I think that in general they've found that yes, there's been good uptake of hand washing, quite almost globally, but that has changed. That kind of has dropped off everywhere over time. But so there are reviews where they've focused on just on the demographic factors and found that based on where you are, based on things like age, there's a difference. As I said, because we were excluding that information, the demographic information, we can't say anything from this review. But I know looking at other evidence that generally I think uptake of hand washing was good, and I think that might be because it is, as I said in Neetu's question, it's probably an easier behavior. There are questions around access and things like that to hand washing, because again, that was something we looked at that we thought would have been important, was to look at resources. But again, it wasn't in the evidence. It wasn't commonly looked at. They didn't. Only a very small number of studies asked about access to, to having hand sanitizer, for example, in different places. So, well, yeah. Thanks very much for the question, Marchang. No, that was great. That was, yeah.
Shall I share a screen?
Yes. So So welcome, Marchang. Thank you very much. We share your screen. Welcome to the stage.
Okay, thank you. Is it visible?
I can see.
Yes,
Yep.
Is it visible?
now I can see.
Okay, thank
So
you.
you need to give full screen, maybe.
Yeah, this is a full screen.
Okay.
Okay. Okay, thank you for the opportunity that is being given to me to deliver in this very prestigious online conferences on What Works Global Summit 2022. I am going to make a brief presentation, which is an outcome of one of my research projects, which has recently concluded, and I have entitled the paper as the Precarious Social Welfare for the reverse migrant workers during the COVID pandemic, and evidence from the northeast part of India. I'll just give a background on the COVID pandemic, which everybody knows, but still I would like to go to relate with the Northeast. You know that the COVID pandemic, yeah, yes, it has created lots of crisis in terms of like the economic crisis, social crisis, and one of the most the negative effect for the individual is the job loss and not only losing a job but also quitting from the job because of the pandemic, and also ultimately as a consequences facing an uncertainty in their livelihood. The migrants, particularly from the northeast, in the different part of the cities of India as well as outside India, they had faced this crisis, particularly relating with the this pandemic disasters on their livelihood. And the most impact was the brunt was, bared by the vulnerable groups who have very low earnings and in terms of income and in terms of livelihood sources. And for that, as the migrants, they adopted various strategies to ascertain their or secure their livelihood from their past savings, from getting the free essential distributions of goods, particularly by various organizations like the government, even non-government organizations, and individuals, including their parents, relatives, and the societies, the churches. And the most important strategies which they have adopted, as everybody knows, as migrants, they have returned back to their origin to secure, expecting they will secure their life, depending on their families and their relatives at home, whom they still considered as the part of their household or part of their family, or very close relative. My primary objective is to examine the various factors affecting the social welfare um, of the migrant workers during the pandemic. I have used my study is basically primarily based on the primary data which was collected from two northeastern states of Nagaland and Manipur during the month of March to May 2021, and the reference period for the data information collection was post March 2020. That means after the lockdown initiative started in India in particular. And I had a sample of 205 individuals who have gone back, who are the reverse migrants. The basic problem started from how they have migrated back to their origin is originating from the job insecurity, which is a very major problem for the migrants, vulnerable migrants, workers who are working in the petty employment sectors, particularly like in the retails, in the restaurants, and all, who earns very low income. Majority, about 72%, had no job agreement. That is the major problem of their job insecurity. So the problem started from the jobs system, the system where there was no job agreement between the employer and the employee. That was the starting point of like insecurity of their job. So they suddenly, because of the COVID-induced lockdown, the closure of the economic establishments and all have led to the job loss. Job loss. Why? How did they lose a job? Is not straight away that they have all been laid off. They give the respondents felt that the employers gave various reasons, like in particular like the closure of establishment, which is temporary in nature, but ultimately like it's same as retrenchment or the late laying off of the workers. And also small proportions of the migrants contract, who among those who have the job agreements contracts was expired. Because of that, they have lost their job, and seeing the chart one, what we see is not only people have lost their job, but also they have quitted their from their job during the pandemic time. A quarter of the migrants quit their job, particularly because of non-receipt of the salary and also salary cut, which affects their living security, economic security, particularly in the urban cities where rain is regularly needed, food payment, or other travel expenditures are regularly needed. And about one third, I'm sorry, not a quarter, one third quitted quitted because of non-payment and salary cut and all, and another one third quitted because of the pandemic itself, because they are afraid, not only because they are economically insecure, but because they are also afraid of the pandemic. They are having some psychological concerns of this pandemic, because people feel that it will have an impact on the health expenditure. It will it will cause a problem in their earnings, in their livelihood, and in the ways of in the like communication between from home and the workplace. The scared because of the because they are afraid of these pandemic related issues, so they have quitted. And another one third quitted their job, not purely because of the pandemic, but also because of the salary cut and all, but because their parents want them to come back, and also they have a concern that when their siblings or when their relatives are moving back from other cities or from their same cities to going back, part of their siblings or friends, they are also adopting, they are also following the path of their friends or their siblings to return back to their origin of the migrations, that is the northeastern states. And the concern was also the salary cut. There were yes, majority did not face any salary cut, but still about a quarter face this salary cut issues. And that was one of these were the concerns, these were the causes which make them insecure, which makes them feel that they will return return back to the origins of migrations to the northeastern states. And yes, yeah, they do have faced lots of problems of particularly joblessness. Yes, out of the 205 individuals, a few were still continuing on the jobs, particularly on online job, particularly the online job, the BPOs, that is business processing, process outsourcing and all. They did not lose the job, but the thing is, they also went back because of various factors, particularly because of the pandemic, because of some fear psychosis from the pandemic. And the concern here is, from my paper, in my paper, which I wanted to address majorly, is about the welfare activities which have been executed, which have been considered by not only the individuals, societies, the churches, or the NGOs, or the government agencies, but mixtures of the to sustain their life. For example, starting from the their own savings from their previous job, and from their own social security, like the Provident Fund or the National Pension Scheme or the employee state insurance and all that they do have. Majority of them do have this bought the saving. I mean, either or bought the savings and the social security, and this was one of the rescuer, I should say, that during the pandemic, that they use this social security to ensure their livelihood security, their economic security, their well-being during the pandemic, when there were uncertainty of job, getting back the job or securing any job. And the thing is, they were, yes, it's obvious, very obvious that they were in need of the money, because their money savings exhausted. They did not get any more the regular salary. Because of that, they end up spending from their savings and withdrawing from their social securities and spending for securing their life. And the second point which I would like to emphasize here is during the pandemic, humanities it's exists. That people have felt sympathy, people care for others, like which is evident from the rent concern. That some rents were adjusted from their rent security deposit, or some they were given credit, and also some people have experience of getting deferment of rent payment, and also the getting some rent concessions, even free rent for some reverse migrants at the place of last residence, that is in the cities outside the northeastern states. So what we see here is that humanity, that the concerns and the cares, even during the worst time crisis of pandemic exists. And the most important feature is about the social welfare, which is being rendered by various organizations, including the government agencies, both central and the state governments, in arranging for food, in arranging for the travel for the stranded migrants, and so on. And also the participation, the contributions from the churches, from the friends, relative. This may not sound like the typical social welfare schemes rendered by the government, but society, churches, and relatives comes together and pool to uplift the migrants, in particular the reverse migrants of Northeast in particular, both in the place of origin as well as in the place of last residence. This is very very evident, very clearly evident. And they depend on the social welfare, particularly on the free accommodations, free like food, water, groceries, even medical expenses. People reported even take care of the medical expenses who were affected by the COVID-19 during the COVID first wave and second wave of COVID-19. And the free travel agreement arrangements, and even free cash distribution. These things were very prominently reported by the reverse migrants, that they received this aid, particularly because they did not have money and they were jobless. That is one concern, jobless, and they were not able to find or accommodate somewhere immediately to secure the livelihood. That was the major concern. And they have some of them have simply they took the welfare assistance, social assistance, just because they were given freely. I think that also happens for the reverse migrants. I think that shows that irrespective of whether they were immediately in need of the provisions or not, they were accepted. They accepted, they took it because it was freely given. And the concern, the thing is that this assistance was given, received for this for around 70 days in average. That means a little more than 2 weeks. People got an assistance from these various sources and these various items in terms of food or water or accommodation and all. So that shows it is a little precarious. Particularly the garments, particularly the garments assistance, central garment assistance, and the state garment assistance. It's not sustainable. It does not last for long. That is what I wanted to say. And also another point is that they also secure their livelihood because of the shortage of money, and by borrowing, by taking loan from some of their friends or relatives during the lockdown, particularly for food and travel and all. I'll come to the conclusion that yes, indeed, COVID pandemic has induced lots of problems, particularly joblessness, and this has adversely, negatively affected to the welfare and the economic conditions of the reverse migrants, which is detrimental to the livelihood security of the reverse migrants. And this is happening basically because their earnings, migrants in their place of last residence, earnings was modest, and their majority did not have job agreements between the employer and employee, and the sudden joblessness because of lockdowns, closure of establishments, so on and so forth. So migrants do attempted, or rather have secured their social welfare or at the individual level from their savings, from their previous salaries, or their current salaries, for those who are continuing in their job, and social securities like PF, NPS, and others, and from the parents and loans. At the community level, from the governments, NGOs, churches, and own community as a society, their contributions and their provisions have secured social security, but it is also again unstable. It doesn't last for long, as we have seen from the government's the assistance which they have received for an average of around 2 weeks. So most of the migrants had received adequate social security, social welfare services, but they were given, they have received for a very short of time, and the social welfare service, which is rendered by the reverse migrants, primarily by the governments, but by the state government at the place of origin, so after they return back from the place of last residence to their origin, and also at the place of last residence by both central government and the destinations government, their services which were rendered during the lockdown was unstable, unsustainable, and precarious, which has an policy which implies that it requires some policy suggestions, like for example, to have regular savings among the workers, migrant workers, and also to ensure compulsory social security schemes, so that it will secure their life during the disaster or during the economic hardship. And establishments of compulsory job contract, I think this is very much the required, particularly who are working in the organized employment sector. And most importantly, promoting the NGOs and the welfare societies through government financial assistance. I think that this is required because in the time of COVID-19 pandemic disaster, we have seen that the social services provided by the NGOs and the welfare societies is very immense, which economically, uplift or get some assistance, particularly in the time of disaster and economic need. With this, I conclude my presentation. Thank you.
Thank you very much, Marchang. Yeah, really, really interesting. And it's those kind of surveys you can get some really in-depth information from. And it sounds like it's also a very important group to focus on, and has needs. I suppose what I found interesting is you talk the reason for people kind of leaving was quite fear driven. That was quite. I wanted to ask you, timing of your work, your project. what was the when you were interviewing people? Was it at the peak of measures, lockdown measures, and things like that, or did the situation locally change as you were talking to people, as you were interviewing people?
Yes, the interview. We conducted a study during the March to May 2021, and that was almost. A third wave, between second third wave, we can say, that, and at that time, what happened was the migrants have already adopted the situations of the places at the environment of the at the origin, at the origin. So they were almost like they don't have much what do you call much negative understanding on the COVID pandemic as they had understand in the place of last residence, that is in the cities other than their state of origin. This was this was conducted through the through the online as well as the Google
Okay.
what it calls this questionnaire, and also mostly were online. So it was the reaction we cannot actually capture because we cannot have more in-depth we did not have an in-depth what do you call investigation because we hardly have we had limited time in the recording the questionnaire through the telephone, and also so we cannot capture much of their expressions, much of their anxiety or so on from the expression. That's it.
I see. Thank you very much, Marchang. That was great. And if I could ask you to just stop sharing your slides and
yeah, thanks.
Thank you very much, Marchang. Thanks so much. So next up to the main stage is Neetu, who's going to share her slides and give a presentation. And we have about 10 minutes left, so apologies for the start, not beginning on time, but we'll hopefully have time for a few questions about your work, Neetu, at the end. So if you'd like to start sharing your screen, welcome to the stage.
Yeah, thank you, Sean. Just seeing. I can't. Just a second. Is my screen visible?
Not.
No. Just a second. Is it visible now? No.
No. If you got, can you see the? Is the grey box?
I'm doing that. I am choosing the point where I have to select, but it's not going. I don't know why.
Would it help if I brought your slides up?
Yeah. That's what is done already.
Okay.
And it's showing over there that it's being shared, but it's not, as you say, it's not.
Can't see it coming up.
No problem. It's showing here that it's being shared, but it's not being shared actually.
No, it might. Sometimes you have to move the tabs over. I'm happy to share your slides if that would help. I know just for.
Yeah, maybe I don't see any. Let me give it one more try, and if it doesn't work, then
sure.
we can. I think it doesn't work, so it's not working. Maybe you may please share my slides if you have it.
Yep, no problem at all.
Thank you. Thank you so much.
There we go. So yeah, I'm happy to move through. If you just ask me anytime you want to
right.
Move through the slides.
Yeah. I'll ask you to change. Right.
Yeah,
right.
Absolutely.
All right. So shall I start?
Yes, absolutely. Thank you, Neetu.
Yeah, thank you, Sean and Marchang, for a very interesting presentation of both of you. I really enjoyed them. And as you know already, this session is on public safety during COVID-19. So my presentation is also in the context of COVID-19. It's more about street vendors, as you can see from the topic. So, I have designed my presentation keeping in mind that it would be 5 minutes, but I can slightly extend the discussion. I don't know. How much time do I have, Sean?
We've got about 8 minutes left.
Okay, so can you please change next slide?
Yep.
Yeah. So basically, we all know that COVID-19, there were lockdowns and street vendors. Vending is an activity. It completely depends on public spaces. So lockdown means there were no markets. So there were complete declining livelihoods for street vendors in India and in most part of the world. So in India, there is an association, National Association for Street Vendors of India. They advocated with the government that there should be some support for these workers because these are informal workers and they are not really connected well with the formal social protection system. So, upon the advocacy of NASAVI, the government of India started a microfinance program for these street vendors. It was about providing a collateral free loan to street vendors for restarting, rebuilding their businesses once the first lockdown was over. So the study was conducted to understand basically, what was not only the impact of COVID-19 on street vendors, food security and livelihood, but also to know that, what worked, what helped them survive during the period and what failed actually. So the study was conducted in 3 cities of India, located in the state of Bihar. There were 1,088 street vendors surveyed, and as I said, the idea was to look at what worked and what failed in the aftermath of COVID-19 with respect to survival and growth of street vendors, and what was the role the scheme that the government launched that played. What was the role the scheme played that was also to be reviewed. So I quickly jumped to the findings. So as we expected, all the respondents, reported that there is a decline in livelihood, and around 50% have responded that they had, they face food problem because of lack of livelihood. Out of the total 1,000 street vendors surveyed, only around 40% had applied for loan and 18.6% had received it. Those who received the loan, most of them acknowledged that the scheme which the government had started helped them in rebuilding their livelihood. 50% of those beneficiaries also affirmed that they were better off than those who could not access the loan, which is named as PMSY. And majority reported to have that to some extent their food security condition was improved after they took the loan under the scheme. And what was the pathway? How come their food security was improved? After taking the loan, they restarted their business and at least they did not have to sleep empty stomach. So interestingly, women reported to have received greater gains than men counterparts. So it may be because of women's gendered role in household welfare and household food security. They are better at saving, better at utilization of resources. So perhaps that's their gain. The gain reported by them was more. So the question is, what worked? So we know objectively that the scheme reached out to only 37% of the street vendors. It helped to some extent. But what actually worked? The thing that worked, so we had both a quantitative and qualitative data. So there was a quantitative survey which asked people to what extent people were asked to rant about their situation during COVID time and in response to government schemes. Then there was a qualitative survey which included narrative, and there were food security assessment modules administered. And then people were asked how they were better off and worse off, how they experienced, how was the entire experience of availing the scheme and otherwise. So what these are some of the quotes from the conversations of the narrative that we had, and these quotes say that government's money, those who received it, the government's money, in terms, even though it was a loan, it was a collateral free, interest free loan, so people, it came as an immediate help. So it was considered as a good initiative. Apart from this scheme, there were other channels through which government help, for example providing food grains through public distribution systems, and giving money in banks or transferring money to informal workers, banks, accounts. So these were also channels through which these workers also, these street vendors got help. So these help were acknowledged. So the thing is that the outreach was not very high of the scheme, but to the extent those who received the scheme, they benefited from it. And also there were multiple programs that helped helped street vendors during those times. So state is one key actor that helped people during those times, to those street vendors. Second was community. There were people, they dependent upon each other. There were vendors group who lived together, who helped each other in terms of crisis. There were friends, there were families, and as one vendor says, that family comes first. If there is a situation of lockdown again, it's only the family saving which will save us. My father has helped me. So, community and family is the second pillar that helped street vendors during those times. And obviously, then there was civil society. Many non-government organizations or charitable organizations were doing lots of work, especially during the lockdown, in distributing food to people, or food grains, and both cooked food to people. So the state was an important actor, the community was an important actor, and the civil society was important actor that enabled the street vendor to sail through and even afterwards. If this worked, what did not work? What did not work? The first thing was that people immediately were, street vendors immediately were under the pressure that they have to repay the loan, because it was not a free lunch. People had to repay. So they did not see, some of them did not see much benefit out of it. Some of the street vendor experienced lots of problem in accessing the loan. They had to run around a lot, and they suffered a lot. Lots of their document requirement was very high, and these are very little educated people, street vendors. So it was very difficult to manage for them. So, though getting the loan was not an easy thing. So as one vendor said, accessibility to the amount was an issue. They had lost the hope. Apart from this, the observation that are coming from street vendors themselves, what our survey saw, that the outreach, obviously only around 35% of street vendors access the, which means outreach is not very high. And when outreach is not there, the entire purpose of the program fails. Second, the process of accessing and availing the loan was slow and complex. There was a lack of awareness. Many street vendors didn't know about it. So what happens? Those who are more vulnerable within the street vending community, like the low educated, they could not access it. So this defeated the entire purpose of the program. So what through this project, what I propose is that COVID-19 and the experience of the aftermath of COVID-19 substantiates the importance of an alternative economy. An economy, this was a situation where market completely failed. It was a situation, market came to zero. It was simply did not working. What worked was state, community, family, and civil society. And these are major component of the alternative economy, which we call a solidarity economy. Solidarity economy is based on mutuality and trust and reciprocity between various stakeholders. So it does not rule out the role of state, but it's about partnership between state and the people and the community. And so basically it's about role of solidarity, mutuality, trust, and reciprocation, along with public redistribution, which government did not only through the PMSY program, although the outreach was low, but through other channels like bank transfer and food distribution. So my conclusion is that the experience that we had during and after COVID-19 economy reaffirms the basis for a solidarity economy. And as Laville said, it is necessary to discover the complementarity of the two forms of democratic solidarity, one based on rights and public distribution, the other on civil ties and egalitarian reciprocity. So people reciprocate to each other in terms of support and mutuality, and government redistributes resources to the needy, and people claim those resources as their rights, and at the same time help each other on the basis of equality, on the basis of principle of egalitarian reciprocity. That is what the solidarity economy, and that's what helped people help street vendors sail through during COVID-19 and aftermath, in the aftermath of it. Thank you. Yeah, thank you.
Thank you so
Thank you
much.
so much, Sean. I forgot to ask you to move the slides, but I think you did on your own. Thank you so much.
That's okay, no problem at all. That was really great. Thank you. So we do have, we've run out. I'd just like to ask one question, or I think both of those topics are really interesting. It's great to hear from both of you. I think your qualitative findings, the quotes were really interesting, that it was clearly a very social part to it that people were talking about. But then the biggest thing the biggest question then is, and you're wrapping up, you talked about the failures, and I think that's always really important when we hear in research what didn't work. So just briefly, how did anything change in response to things not working, or did it sort of just stay the same?
Yeah, so government processes are quite prolonged processes. They do not happen overnight. So after this project, we submitted a report to the government of India on our findings, and they are in the process of reworking the scheme. So looping in more civil society members to create awareness. But I think it's taking longer than it should. But yes, it is it has affected the government at least to change its approach, but actual impact is yet to be seen.
Okay, thank you, Neetu. That's great. And if anyone else has any questions, I would email me. I have probably other questions, so I think I might drop you an email on some of those. So if anyone else would like to ask Neetu any questions, her contact details are shown there. But as we reach the end of the session, I'd like to thank both of our speakers for two very interesting topics. Some similarities there in the methods, but some really important takeaway findings for us. So thank you very much.
Thank you. Thank you for hosting us. Yeah.
I hope everyone enjoys the rest of the meeting, and it was nice to see you all. Thank you very much.
Nice to see you too.
Thank you. Bye-bye.
Thank you. Bye-bye.